Tiza, what is CBE?
Well, CBE is a community-based education. It's a program that is run for 3 years, 4 years, and 6 years here at Ridgeway, and it's basically a program that helps us get exposure to the community and different health setups, just for us to get the necessary training before we actually get into the actual work of being a doctor. So it just basically gives us experience, helps us find out what's going on in the communities, how people are living, and it helps us to come up with possible solutions to the different challenges and problems that we get to feel like people are facing out there. And it also just gives us a scope and an understanding of how people live and how people relate and how much people know about their health. So I think that's what I can say about it.
Okay.
Hi, Marsha. We're allergic to the camera, Marsha.
No, you're supposed to tell me what you have learned from CBE.
I learned a plurotap, how to do a plurotap.
What is a plurotap?
A plurotap is when he inserted the cannula into the intercostal space so that he could drain the fluid. Yeah.
Steffi, what did you learn?
CBE has been interesting. We learned a lot of things in the ward rounds that we've been having in Kanyama. We learned more about the conditions that we've been learning in class, like pneumonia, anemia, TB. Just seeing those patients and the hands-on experience has been good.
Okay.
Yeah.
Martha, what did you do yesterday?
So yesterday I went to the obstetric department where we witnessed childbirth, postpartum hemorrhage, also how to do the urinalysis, how to measure the blood pressure. Yeah, basically that.
Okay, Jane, what are you going to do today? What do you mean? What are you going to do today?
I'm going to be in the EH department,
What does EH stand for?
environmental health technician.
Okay, so what do you think you're going to be doing when you're working with the environmental health technician?
I think it's there.
Yeah, tell me what we're going to be doing today.
Okay, so today it will be our first time encountering, what we're going to be practicing as medical doctors. We're going to meet patients for the first time, and we're going to learn from the medical personnel, the nurses and other doctors that are there. They're going to teach us how to handle these patients. Yeah, so we have the knowledge already. We learned a lot, but today is all about practice, and we are geared and ready to meet our first patients.
Are you excited?
Very excited.
Are you scared?
Not really. I've been looking forward to this for
For a really long time?
4 years.
4 years?
Yeah.
Wow.
So since first year, I came here not just to be doing labs all the time. So today will be really a fun day for me because I've been waiting for my first patient for quite a long time, and I can't wait to actually meet a patient and help them.
Okay.
Yeah, because it's what we came here to do.
Okay,
Yeah.
cool.
So yeah.
Bernard, what are you most excited about doing today? Just shout.
Well, I'm really excited today because firstly we'll be handling patients for the very first time, which quite alright, might be a little bit, might be a little bit anxious, but it's really exciting because we're having this first experience that we've always been looking forward to. And well, as my team here,
Yeah.
so we've divided ourselves into various departments where we'll be working from. Personally, I'll be working in the MCH department, which is Mother and Child Health Care Unit. which is a very interesting department because we'll be dealing with mothers there, some are pregnant, we'll be dealing with their children. So it's really interesting, especially for the love that we have for our patients, the mothers and the children. I think it's going to be an awesome experience.
Okay, cool.
Everything. You are trying to do the couch. You show that you're trying to record the couch.
I'm not taking pictures. I was told today you did a COVID swab. How did that go?
Well, the COVID swab, it's very easy to do it on someone, but for me it was painful.
It was painful.
I think my pain threshold, as you said, it's low.
Your pain threshold is low.
I actually cried.
Okay, what else did you do today?
My favorite.
Your favorite? What is your favorite?
Cervical screening.
So you did cervical screening. Did you actually do the procedure or
No.
you were observing?
No, yeah, I was observing.
But are you
But
ready?
it was practically like me doing it.
So you were able to see the things that we did in skills for the first
Yes.
time.
And that's the amazing part. Like the way they are, the pics in books, that's how it
That's how it looks. Okay.
Except it's hard. And it's painful. The book slide is painful.
It's painful. Okay, so are you excited to do that in the ward in a
Yes,
couple of
please,
weeks?
that's the first thing. The first thing I'll be doing.
Okay, cool.
If a child is born negative, they still test and they give specific instructions. But I noticed that to some parents, if they're not explained to properly, they might not follow the instructions they're given. For example, they're told to come after maybe 6 months. But if they don't come after that period, meaning that they put their child at risk of getting infected, that's if they are breastfeeding. And there are some other instructions where they ask them not to start feeding, not to start feeding the child at a certain age. But if they are not compliant to that, they put their child at risk. Now you can imagine a child who was born negative and with time they contract the virus because of the mother's maybe carelessness or lack of compliance. So even as we are getting to be medical professionals, I think it would be important to explain to the mothers the importance of following the guidelines they are given.
So after the babies, after it's confirmed that they are negative, after 2 years, they are free to go. Like if they're negative, they are free, and then if they're positive, that's when they are taken to ART to start their ARVs. Yeah, and then for the EST department, now we complained about the health education. So it's like as doctors and as health practitioners, we have to sensitize people about these common diseases like cholera and COVID also, because other people are still not believing that it's there, but you have to tell them like it's actually real. So you have to sensitize people out there and tell them to mask up and sanitize all the time.
But also caring about the life of this patient. What happens after this patient leaves my office? It's not just about giving them the drugs and a sort of form of treatment, but we've talked about counseling. Like that sister that kind of told the patient, care about the kids and whatsoever. I think we should be like that. Don't only care about the disease that the patient has. Treat the patient, don't treat the disease. I think that's the motto that we should move on. Yeah. What do you want?
Based on a true story of Vivian, the guy in the 1930s. Like the guy was actually a janitor, but he's actually part of the team that actually discovered a solution for blue babies, like how it's supposed to be treated. Yeah. So it's more like.
Is that the story?
Vivian.
There was somebody from South Africa.
Yeah.
Somebody from South Africa, I think he used to smoke, used to kill him, but now they even gave him I think they gave him a degree or something.
Honorary doctor.
Yes. Is it the story about him?
Yeah.
He was just an ordinary cleaner, but just from noticing what they were doing, they could even do much better than most.
Yeah.
that the story about
Yeah, the same story. So one thing that I got from that movie I've seen today, because there was a part in that movie where the doctors started looking down on this guy just because he was a janitor and he was just a lab tech, but he knew more stuff compared to the doctors. But there was this one doctor who was willing to learn from this guy, and he learned a lot from that. So it's also important for us to humble ourselves and also be willing to learn from anyone and not look down on other people.
I noticed that there's been a department for people who don't adhere to medication. Yeah. So if you look at it, people look at it from the patient's point of view, and the patient is not adhering. But what about the medication itself? So from the pharmacology department, we learned that they take about, for an adult, take about 1 tablet every day for 30 days. Yeah. So I think it's a bit stressful taking the tablet every day. Yeah. So I was talking to Mr. Ministry about it. Then what he said was that actually there are even better medications outside. Like give an example of, like, in America, they give injections for about 3 months or 6 months, so you just have to come once. Yeah, but then I asked him why it wouldn't be better to have that, but himself he didn't want it, because he'd be like, if such an injection came to Zambia, he would lose his job. Yeah, the angels lose.
This is where I'm thinking about myself.
Yeah, he was like, he has to come here every day, but if such a medication came, maybe we just come here once in 6 months, then who would pay him for that? Yeah, so if he moves here thinking like that, what more the companies that actually produce the medication? Yeah, so maybe just as Chimka said, that as doctors, maybe we can be looking at moving to a digital world. Maybe we can also move to. Yeah. Yeah. So other than moving to digital, maybe we can also look to getting better medication for the people, because I think getting better medication for people around us is much better than $1 million or anything. Yeah.